I got two textures. I just put this mask on here, and now I officially protected COVID from SARS, from influenza.
In this video, we're going to look at a study recently published by the Cochrane Institute about the effectiveness of masks at preventing respiratory viruses. And in case you've never heard of Cochrane before, they're a global network of independent researchers who decide, based upon all the available evidence, whether a particular medical intervention is warranted or not. And I like Cochrane personally because theoretically they have a much lower risk of bias than any other researchers who might be funded by a corporation or by a giant pharmaceutical company. So when Cochrane does a study, they generally will search a lot of different medical databases and they try to collect as much evidence as they can find. Then they appraise the quality of the evidence based upon a bunch of criteria, like how was the study performed? Was it randomized? Was it blinded? How was the study funded? Is there a huge potential for bias, etc.? Then they take this data, they look at these studies, they analyze and they synthesize all the data and they draw a conclusion about whether the medical intervention that they're researching is actually of any sort of benefit. There are, of course, limitations to this kind of research, but for now, it's probably the best bet we have at determining how effective these masks here are at preventing viral respiratory illnesses. Before we get into the study, let's talk about masks. Initially, when the masks came out, I thought they were kind of a silly idea. We've got this thing that covers our face. We know our mouths harbor a ton of bacteria and provide a human environment that is conducive to bacterial growth. And so I thought our masks were just kind of like these mobile incubators with strings on them, and it just allows us to go around and potentially spread more bacteria, viruses than we otherwise would have. And I can't tell you how many times I would be adjusting my mask or see other people adjusting their masks. And then I thought, unless we're sanitizing before and after we touch our masks, aren't we just more likely to spread germs? After all, we touch it and then we go touch something else and now somebody else touches that. And isn't that how germs are spread? And then even if we do sanitize before and after we touch our masks, at least here where I live where it's super dry, our hands are going to get extremely cracked. And now we've got cracked hands, which provide, of course, another hiding spot for germs to hide. And then what about the fact that masks seem to decrease our overall oxygen intake, and how important is oxygen intake to our overall immunity? Another thing I wonder about is how big is the virus? How big is COVID-19? I mean, like physically, how big is the virus and how big is its transport mechanism? And is the mask small enough to prevent this kind of transport? Now, I don't know enough about masks and the size of the virus or how it was precisely transported to have an educated opinion, but I was definitely skeptical about the mask's ability to prevent viral transmission. So after taking all of this into consideration, it seemed to me, if anything, the mask might actually contribute to spreading germs rather than hindering the spread of the virus. Although I also thought maybe they really did help, because if you've ever watched someone who is talking while the sun is shining on their face, like through a window or whatever, you can see how much spit actually exits the mouth. And so I thought, okay, well, wearing a mask probably prevents a lot of these salivary droplets from exiting the mouth. And so maybe it does prevent COVID. But who knows? All I wanted to see were some randomized trials of mask versus non-mask wearers who occupied the same environment for the same length of time to see who contracted COVID and who didn't. But I doubt that study was ever performed. Nevertheless, let's take a look at the Cochrane study to see what they found. So the main question they wanted to answer was, do physical measures such as hand washing or wearing masks stop or slow down the spread of respiratory virus? And in this video, we're not going to focus on the hand washing. We're just going to focus on their findings surrounding wearing a mask. So after looking at all the available evidence, they said that we are uncertain whether wearing masks or N95 or P2 respirators helps to slow the spread of respiratory viruses based on the studies we assessed. Again, they concluded they are uncertain whether these masks that we wore or are wearing now actually do anything. So after years of wearing masks, after the millions and millions of dollars spent on mask production, after people have been arrested for not wearing masks, after forcing healthcare workers to don a mask so they can continue working, after requiring that people wear masks just to go out in public, a bunch of independent researchers who looked at 78 relevant studies are now telling us they are uncertain whether or not these masks did absolutely anything. They are uncertain whether the masks did anything. And I feel like this all just pretty much sums up public policy and healthcare. But let's continue. Out of the 78 studies they looked at, no studies looked at face shields, gowns, and gloves, or screening people when they entered a country. No studies. And yet how much of our public policy involved these kinds of measures? In fact, when I worked at the state hospital, we were sometimes not only required to wear this bad boy, this N95 mask here, we also had to wear a face shield over the N95 mask. And you wouldn't think a face shield on top of an N95 mask would make much of a difference, but it does. It's wickedly hot and humid and uncomfortable. Imagine having to wear a face shield and an N95 mask for 12 hours straight just to make ends meet. It's not a pleasurable experience. Now, what's funny is if we looked at when this study was published at the end of January of this year, we'll notice the CDC still recommends wearing masks. Why am I not surprised? I'm guessing it will be a year from when the study was published before the CDC and our local health departments stop urging people to wear masks. Anyhow, let's get back to the Cochrane study. After reviewing 9 studies with a total of 276,917 participants, Cochrane determined wearing a mask in the community may make little to no difference in how many people caught a flu or COVID-like illness. They also found out when it came to people who contracted the flu or COVID, confirmed by a laboratory test, wearing a medical or surgical mask also probably makes little to no difference. And that was after reviewing 6 studies involving a total of 13,919 participants. So apparently surgical masks don't work that well. Well, how about the N95 masks? What's the data showing for them? Cochrane reviewed 4 studies done with healthcare workers and 1 small study done in the community. Compared with wearing medical or surgical masks, wearing N95 or P2 respirators probably makes little to no difference in how many people have the confirmed flu or a flu-like illness. To come to this conclusion, they reviewed 5 studies with a total of 8,407 participants. And wearing an N95 mask probably makes little to no difference in preventing any kind of respiratory illness, according to Cochrane. And for this, they looked at 3 studies with a total of 7,799 participants. So essentially what's happened is we've mandated millions of people to wear some sort of mask over their face without the evidence to support this medical intervention. When it comes to N95 masks making little to no difference in preventing laboratory-confirmed respiratory viral infections, Cochrane researchers state they are moderately confident, meaning that the true effect of masks is likely to be close to their estimate, but they do acknowledge the effect could be substantially different if new evidence were to come up and perhaps contradict their results. Additionally, most of the studies they reviewed were done during the traditional peak respiratory virus infection seasons up until 2016. So most of the studies they analyzed did not involve COVID-19, but instead consisted of other viral illnesses like the flu or its variants. The authors do point out that 2 relevant randomized trials conducted during the COVID-19 pandemic have been published, but their addition had minimal impact on the overall pooled estimate of effect of mask wearing. The authors do acknowledge there could be several reasons for why the observed effect of masks wasn't as prominent as they may have otherwise expected, and here are some of their reasons. They say poor study design, making it difficult to determine mask effectiveness. There was also insufficiently powered studies arising from low viral circulation in some of these studies conducted. So imagine trying to determine if masks actually do anything when the infection rate is already low, regardless if someone is wearing a mask or not. Another reason they give is lower adherence with mask wearing, especially amongst children. And if you've ever seen children wear masks, it's depressing and hilarious at the same time. Depressing because they need the oxygen, and hilarious because their masks are often soiled and in all sorts of bizarre positions on their face.
So, anybody else's kid come home with their mask all wet because they've been licking it the whole time they've been in school?
The researchers also mentioned the quality of masks used could have affected the results, as well as self-contamination of the mask by hands, which is what I mentioned earlier when I saw other people, including myself, frequently adjust their masks with dirty hands. They also mentioned lack of protection from the eyes could have exposed people to respiratory droplets. So maybe the masks are working, but the researchers are suggesting that, well, these droplets could have entered the nose from the lacrimal duct, which is in our eyes. And so the mask could have been working and people could have been getting infected through another route of entry, if that makes sense. Another reason they give is masks being overly saturated with saliva from extended use, which promotes viral survival in proteinous material. This is what I mentioned earlier about how we're all just walking around with incubators tied to our face. And the last reason they mentioned is possible risk compensation behavior leading to an exaggerated sense of security. So I might just be like, hey, I got this mask on, so let's go to a crowded place and mingle with a bunch of people. And maybe had I not been misled on the effectiveness of masks, I wouldn't have been so brazen to be around other people, but who knows? I think what Cochrane really is trying to point out here is that their level of certainty with the conclusions that they draw about wearing masks, which in this case was moderate, can only match the quality of evidence reviewed. And given the limitations of the data, it would be foolish for us to say categorically that masks do not work because the quality of evidence doesn't necessarily support it. Likewise, we can't say that we ought to or should wear masks because, again, the quality of evidence doesn't support it. What we did do, though, is pretend that we knew masks made a difference, mandated people to wear them, and then had no high-quality evidence whatsoever to support these measures. I hope you found this video helpful, and as always, make sure to wear a mask.